Warning, your child may be at risk. A new pandemic is sweeping our country. The following presentation uncovers what, why, and how this pandemic can cease to be spread.
We know that adolescents with language disorders are at far greater risk for substance abuse problems, depression, school dropout, teen pregnancy. Not that the language disorder causes that, but it only makes sense that it contributes to those disorders. And we rarely talk about that in terms of how we might infuse some mental health supports for those kids in therapy.
Changing attitudes to change lives. Emotional literacy as a therapy tool. The following presentation discusses an important developmental concept in today's society. It is called emotional literacy, which is the capacity to register our emotional responses to the situations we are in, and to acknowledge those responses to ourselves so that we can recognize the ways in which they influence our thoughts and our actions. Emotions have many faces: anger, happiness, sadness, frustration, excitement, shame. They present themselves as positive or negative feelings or actions that sometimes turn into irrational, self-deprecating behaviors. Dealing with the negative side of emotions is not always easy, and some of us do not have the emotional tools to fix the waves of anger, sadness, and guilt.
If we don't consider the social aspect of communication, whether you're talking about speech sound production or language or fluency or voice or cognition, whatever it is you're working on, you're really missing the boat. You're seeing the trees, you're not seeing the forest. So I think that's important, and I think it's important that we talk about emotions in the therapy setting.
As parents, future parents, and educational professionals, we need to be emotionally literate so we can teach our children how to be emotionally literate. Much research has shown that children with high emotional intelligence grow into much more productive members of society because they avoid positive emotional inhibitors like drug use, drinking, and promiscuity, which can in turn lead to poor academic performance, faulty interpersonal relationships with family and peers, depression, and maybe suicide. Many emotional literacy programs have been created to target specific ways to deal with negative emotions before they turn fatal. I believe with the aid of ideas from emotional literacy programs like First Steps, 6 Seconds, and Roots of Empathy, educational professionals can implement emotional literacy techniques into their lesson plans and therapy modules to alleviate the symptoms that come with having a communication disorder. It is very common for clients with voice disorders, a stuttering problem, or even language and articulation deficits to have frequent feelings of anxiety and low self-worth. Emotional literacy methods established early in these clients' lives can give them just the confidence and intrapersonal value they need to flourish and feel acceptance throughout their lives. Let's always remember how we enter this world, with pure minds free from fear and worry. And now, ask yourselves, is that worth keeping? If your answer is yes, then help prevent fear and worry in our children by using emotional literacy techniques in therapy or your educational lesson plans, even if it's just for 15 minutes 2 times a week. We can do it. We can make a difference.